Both children and adults experience vision deterioration. Let's look at the real causes of these problems and find out how we can not only stop the progression, but also restore vision. I'm Dr. Vasyl Chaika and I'm here with you. Watch this video until the end and you'll learn about effective exercises that, by doing just 5 minutes a day, can help you restore your vision. According to statistics, today there are 1.6 billion people in the world who have vision impairments, specifically what is called myopia. They cannot see into the distance. And what's interesting is that if we look at the data from, say, 30 years ago, there were 3.5 times fewer such people. In other words, the more we develop and the more modern technology we have, the worse our eyesight becomes. And of course, today it is said that it is the younger population whose eyesight is deteriorating the most. And the reason for this is what we call gadgets. Computers, phones, tablets, laptops, and so on. Because nowadays we spend most of our time constantly looking at something that is what? Right under our noses. And we need to see it very clearly. Of course, there are a huge number of methods available today. And unfortunately, the essence of all these methods is not to restore vision, but to lock in the problem at its current level. So let's now look at the reasons why this situation occurs and the methods we can use to improve our vision. So, in modern medicine, the main theory that dominates is that vision impairment is connected roughly 80% of the time with dysfunction of the eye muscle. These include, for example, the oblique muscles of the eye, the straight muscles of the eye, which allow us to move our eyeballs. There are also the so-called ciliary muscles, which regulate the width of the pupil opening so that the appropriate amount of light enters. What else is an important point? What are all the actual treatment methods aimed at here? At changing the fixation of the image on the retina. That is, if the image is fixed not on the retina, but either behind or in front of it, then we start to see poorly. Glasses or lenses or various laser correction methods allow us to focus the image on the retina. But this does not solve the problem if it is related to the muscle. Another important point to mention here is the disorders of other structures of the eye. For example, the same cornea as well as the vitreous body. But this occurs much less frequently. The third cause of vision impairment is the dysfunction of internal organs. For example, liver dysfunction in cases such as fatty hepatosis or cirrhosis of the liver, or with prolonged bile stasis. For example, when bile accumulates in the bile ducts and the liver increases in size, this leads to clouding of the lens, which also results in vision impairment. But this is rare. What else is important? These were the physical aspects. But in addition to the physical aspects, we also have what we call emotional problems of an emotional nature. In this case, an emotional nature means when we don't want to see something or we wish we could see it differently. You might say, well, this is probably some kind of psychosomatics. How does all of this work? The answer is very simple. If we take a brain CT scan, you will see that it is precisely in the sensory cortex where the centers controlling certain structures of the eye are located. And so, when a certain reflex reaction arises, which can be described in words as, I don't want to see this, that is, I would like to see something near me, or for example, farther away from me, this area becomes activated and we can easily verify it by doing a CT scan. Right now, on the CT scan, you can see the active center, and here you can see the same kind of change also occurs in the eye. That is, the change does not first occur in the eye. First, an event happens that the person interprets in this way. A certain area of our brain reacts to this event, and then it triggers changes in the body. So that's how it works. You might ask, well, can this be proven? Of course. Let's move on to that now. As you may have already understood, in my practice, I rely only on a comprehensive approach that considers the human body as a combination of the physical body, brain function, and our psyche. Before we move on to the evidence, let's first figure out, is it really possible to restore this vision? And to what extent can this vision be restored? For example, if I have -2, will it become 100%? And if I have -5, will it be restored? And what if I have -10? This is the most common question people ask. Yes, your vision can improve significantly and even become 100%. This is really true. And now let me give you some examples. A woman came to me who has a son. One eye sees well and the other eye sees into the distance. Everything was fine just a few years ago, nothing had changed. And of course, this woman lives in the States with her child, and the doctor said, oh dear, you urgently need surgery or your child will go blind. If we use only a physical approach, then yes, of course, only surgery. But if we look at it comprehensively and figure it out, then the following becomes clear. If the eye starts to see far, that is, why does the brain activate this function? In order to catch something, to see better. But what did he want to see? And in this case, it's that his father is constantly at work in order to provide for his family. The father leaves for work while the child is still sleeping. And he comes home when the child is already asleep. Do you understand? And let's say rest only happens a little bit on the weekend. And even then, the father works on the weekends too. In this case, it's clear why it's the right eye, because if the child is right-handed, the right eye is responsible for searching for the father, so it started to drift off into the distance, while the left eye is fine because the mother was always present. What was recommended? In this case, the father needs to spend more time at home. The father switched to working remotely. After 6 months of being at home, the boy's vision became 100%. Let's look at another example. This was also a child who went to school. Everything was fine, everything was great. And then when moving from 8th to 9th grade, their vision suddenly started to deteriorate sharply. Well, of course, they say it's a physical problem, as always, and that glasses are needed. But we take a comprehensive approach. When we check the physical aspect, we also need to check our psyche. And what was discovered there? That a new teacher had appeared? And this teacher was very demanding. She wanted her 9th grade class, since she was the homeroom teacher, to perform the best, but she tried to achieve this through physical punishment. And the girl was delicate, used to something completely different because she had come from a completely different school. She was used to different behavior from teachers, and she didn't want to see this, especially when her grades were unfairly lowered. "I don't want to see this injustice," the girl told her parents. They didn't pay attention to it. And of course, her eyesight started to deteriorate. Why? Because I only want to see what's right here next to me, and I don't want to see the injustice happening around me. What was the conclusion? To wear glasses? No. The girl needed to be transferred to another school. And when the girl was transferred to another school, her eyesight completely returned to normal within 3 months. But first, let's sort this out together. So what needs to be done? What should you do every day to keep your eyesight normal? When you already know the reasons, when you already know that eyesight can really be restored, what should you do now? And here we need to simultaneously address both the physical and emotional components. So how do we influence the physical aspects? You don't know exactly whether it's your ciliary muscles or other muscles, or if there's an issue with your lens or cornea. You don't know this. That's why there are universal exercises that help influence the physical component. The essence of these exercises is to restore the anatomy of the eye, meaning that the eye muscles relax, the lens returns to its proper shape, and the eye itself neither stretches nor contracts. How are these exercises performed? These exercises can be done whenever it's convenient for you, and ideally, you should practice them every day for just 5 minutes. So by doing these physical exercises for 5 minutes daily, you will be helping your eyes on a physical level. How is this done? You take your hands like this, using these parts of your palms. Press them against your eyes. Hold for 2 seconds. 1, 2. Then open your eyes and look at the closest point you can see. 1, 2. When your vision has focused, you will see clearly. Next, try to look as far into the distance as you possibly can. I always recommend doing this exercise in front of a window. Just make sure there are no buildings in the way so you can look far into the distance. Again, do this until your vision focuses on the farthest point you can see. And then you repeat this again. 1, 2, press, 3, 4, focus on a nearby distance, 5, 6 on a far distance. Maybe you'll need to count not just to 2, but to 3, 4, or even 5. But what's the main point? Press, focus on a nearby distance, and focus on a far distance. And that's enough of this exercise on a physical level. You can also do one more small additional exercise. This is when you're moving, that is, you're walking, and at the same time, closing your eyes. How do you do it? 1 step, eyes open, 2 steps, eyes closed. 1 step, eyes open, 2 steps forward, eyes closed. Just, of course, you need to make sure you don't bump into anyone or hit a tree or anything like that. In other words, there should be no objects or people around you. How does this exercise work? This exercise helps the brain to quickly focus on objects, which will also improve your vision. At first, we don't see anything, and then suddenly there are a lot of objects, just like that. But that's the physical component. Now let's move on to what's called the emotional component, because we also need to influence that. So what needs to be done here? First of all, take a sheet of paper if you're an adult and thoughtfully write down everything you absolutely wouldn't want to see or experience in your life. Maybe even the life you're living right now. Maybe that boss, maybe that husband. Maybe you didn't want to see your children turn out this way. Maybe not the situation that's happening in the country. What is it that pains you to look at? What injustice do you see that you wish you didn't have to witness? You need to write all of this down on the sheet of paper. If these are young children, of course, they can't write yet. So you need to talk to them and ask, what is it you wouldn't want to see? Or what injustice do you see? A common situation that often comes up here is when the father argues with the mother and they are sorting out their relationship. Yes, but you wouldn't want to see when your father and mother, who are two halves of one whole, are arguing with each other or when they separate. Or a situation where the mother leaves the child because she needs to go somewhere. Or a teacher who yells at the child and gives them a low grade. But I studied all day yesterday and she gave me a failing grade. Because the child doesn't understand how our whole society is structured. That's why it's important to explain to them that getting a bad grade or your mom and dad arguing won't change anything. You won't die from it. So the key point in working with emotions, once you've identified the reason for what you don't want to see, what you'd like to see differently, or what you'd rather, as they say, just close your eyes and never see in your life, is to now lower its significance. How do you do that? You start thinking biologically. Biologically, it means, does it threaten your life or not? If it's a little child, well, okay, you got a bad grade. Did you die? Of course not. If you didn't get a red diploma, does that mean you're a bad student? No, for example, I didn't get a red diploma. I know many doctors who didn't get a red diploma and they are the best specialists in their field. Yes, because, as they say, there were no connections, right? That's what it was all about. So it doesn't affect your life. In your life, for example, if I don't want to see war, well, okay, you don't want to see that. Would you like to see peace all over the planet? But that's impossible. So, if you live with such expectations and don't give it meaning, don't think biologically, yes, there's a war, but at this very moment I'm dying, nothing will work out. Your vision will keep getting worse. I get a meager pension, I worked hard for this country my whole life, and look, my children have left and I'm left alone. Now I can't even see them. So if we look at life with this kind of attitude, then what? We don't want to see the problems in this. And your vision will progressively deteriorate. But when we simultaneously act on the physical level, that is, do those exercises for just 5 minutes a day, plus address the emotional component, you'll see how your vision will start to recover. This was Dr. Vasyl Chaika with you. See you next time.